Hey, this is Dr. Green with Momenta Chiropractic, and today we're going to go over 90-90 breathing, which is a good way to be able to kind of transition normal intra-abdominal pressure to some other positions where we might do some exercises in, and one of those is the 90-90 position. So what we're going to do is we're going to have her bring the hips up to 90 degrees, right? Knees at 90 degrees, and ideally we want ankles also flexed at that 90-degree angle to the shin. With this, we're going to use that intra-abdominal pressure technique that we practiced, where we're taking breaths in, being able to expand the belly, and then holding that pressure as we breathe normally on top of it. So if we do this properly, right, if I were to add any resistance when she has pressure, I shouldn't be able to, right, push her legs down. She should be able to resist and feel that in her core rather than her back. Sometimes it can be challenging to try to transition this breathing technique into a position like this where the core is kind of activated to lift the legs. So we can do it passively by taking a ball or using a couch. You can let the feet come down where the hips are elevated, and then we can just practice breathing in this position. So I'll have her kind of place her hands just above the iliac crest, or that kind of like hip bone on the side there. And then just work into practicing breathing in this position where she can get full expansion with the hips raised, right? And then she can practice taking breaths in, maintaining that pressure into her hands as she breathes normally on top of it. When that becomes easier, then we can kind of take away the stability of the ball here, right? She can bring her legs up. We can roll that ball away, and then she can practice just with a little bit of gravity's resistance, right? Being able to breathe in that position, and then we'll transfer this into exercises like core stability, things like the Deadbug and whatnot. So that is 90-90 breathing, and it's a great way to be able to kind of continue progressing with intra-abdominal pressure work. So.